Hi, it's the pharmacist Sinki here. Today we are going to talk about hay fever treatment. Hay fever is also called allergic rhinitis. Its symptoms include sneezing, runny or congested nose, sinus pressure, red, watery and itchy eyes. It is not caused by a virus but allergens such as pollens, dust mites, animal dander like animal fur, feather, dead skin, saliva, and whatnot. When we are exposed to allergens, our body mistook the allergen as a dangerous invader, thus releases a chemical called histamine, and this triggers hay fever allergic reaction to combat the allergens. So how do we treat hay fever? One of the treatment for hay fever is to remove the cause. Identify what the allergen is, remove and avoid it. Such as, if it's outdoor pollens that you are allergic to, close your windows, wear a face mask when you go out, use air filters at home, remove carpet with floorboards or tiles for easy frequent cleaning. If it is pet dander you are allergic to, you might want to get someone else in the family to look after your pet. Keep them outdoors or give it to someone who could look after it. An effective way to find out what causes your hay fever is to do an allergy test. This is run in a hospital or a special clinic. Speak to your doctor for more information. Now, it is sometimes not practical to 100% avoid things like pollens, so there are some medications that you could use to help relieve hay fever symptoms. What are they? Number 1, antihistamine. Antihistamines block the effect of histamines to reduce hay fever symptoms. There are basically two types of oral antihistamine, less sedating and sedating antihistamine. Less sedating antihistamine are like loratadine, desloratadine, fexofenadine, cetirizine, and whatnot. Out of all of this, cetirizine is the most likely to cause drowsiness. Sedating antihistamine are like chlorpheniramine, dexchlorpheniramine, promethazine, and whatnot. These antihistamines can cause drowsiness, so if you are affected, do not drive or operate machineries, and remember to avoid alcohol while taking these antihistamines. All antihistamines work equally well, but not everyone responds to it equally. So when it comes to choosing an antihistamine, you could simply pick any antihistamine starting from the less sedating ones and move on to a different one in the less sedating antihistamine category list. And after you exhaust all the less sedating antihistamines, move on to the sedating ones until you find the ones that works best for you. Some people report that the antihistamine that used to work for them stopped working. If that's the case, it's time to switch to another antihistamine. Antihistamines also comes in different forms such as eye drops, ear drops, and nasal sprays. These antihistamines are like acetylestin, levocabestin, and whatnot. In a nutshell, there are so many different types of antihistamines out there that I didn't even finish listing all of them. Every country would have different types of antihistamines for sale. So the fastest way to see what's available is to check with your local pharmacist. Another class of medication that can help to relieve hay fever symptoms are corticosteroids. Corticosteroids calms down the inflammation of the hay fever. There are many types of corticosteroids in the market, such as mometasone, budesonide, fluticasone, and whatnot. Corticosteroids comes in different forms like nasal sprays, eye drops, ear drops, oral tablets, and even injections. Remember to let your pharmacist or doctor know if you have any other medical condition, on any other medication, pregnant or breastfeeding before using any antihistamines or corticosteroids. Now, besides antihistamines and corticosteroids, there are also other medication and methods that you can help relieve blocked and runny nose or a hay fever. I have talked about them in my How to Treat a Runny and Blocked Nose. I will put a link down below for you. Now, there are also something called allergen immunotherapy for treatment of hay fever. So instead of avoiding the allergens are introduced into your body in a systematic, controlled, gradual, increased way over a period of time. until the body is immune to the allergen. This method is usually used for people who have severe symptoms, people whom allergens are hard to avoid, people who want to avoid medications or does not react to medication or has severe side effects from the medications. Talk to your doctor if you are interested in this type of therapy. In the next series, I will be talking about sleep and insomnia treatments. I will also be putting out more health-related videos to help improve your health. This is a COVID, cold, flu, and treatment series. Please hit the subscribe and notification button so you don't miss out on any of them. Please do give me a thumbs up. I will also be putting out more health-related videos to help improve your health. I do run a second channel where I put out my original music and entertainment videos. If you are interested in it, I will put a link down below for you. Let me know what other questions you have, what other videos you would like me to make, or if you would like to share any of your experiences or thoughts, please feel free to leave a comment down in the comment section below. It's your pharmacist Sunki here. See you around.